The other parent skill I like to talk about is understanding when our babies send out an SOS. And SOS stands for sign of overstimulation.
All newborns are at times overstimulated as they adjust to being out in the world. Babies who are born early SOS more often. The first way babies will send out an SOS is with changes in their body's skin color, movement, and breathing. Caleb, who was born a few weeks early, shows all these SOS body changes. See how his face turns a bit red in color, his muscles jerk and shake, and his breathing gets faster. Some babies will hiccup as well.
Then the other set of behaviors that I like to think of as SOS is what I call spacing out, switching off, and shutting down.
2-week-old Elizabeth demonstrates the first behavioral SOS, spacing out. Watch as Jan plays with Elizabeth by shaking the rattle. Elizabeth begins to look like she's staring into space. This spacing out is a clear sign of overstimulation. 3-week-old Anna demonstrates the second behavioral SOS, switching off. As her mom patiently tries to get her attention, Anna looks the other way. The harder Mom tries, the more Anna switches off. Mom soon learns that this switching off is a sign of overstimulation and not her baby rejecting her. Elizabeth demonstrates the third behavioral SOS, shutting down. Again, we see Jan playing with Elizabeth. Though Elizabeth is momentarily engaged with this play, she soon begins to get drowsy and shuts down as a response to too much stimulation. Remember to watch for SOSs, look for body changes in color, movement, and breathing, and watch for behavioral changes, spacing out, switching off, or shutting down.
So, of course, when we see a baby SOS, we'd wonder, well, what do we do to help them? And there are two ideas that will be helpful. One is to decrease the amount of stimulation, and the other is to increase the amount of support we have of the baby. So by decreasing stimulation, we might do something like quieting our voice, talking a little more quietly. Then the other thing is to increase support, and we do this by things I've seen you do, like hold his little hands to his chest, swaddling him, and I bet Dad likes to sway him where you kind of bounce him like this. And also sometimes sucking either the breast or Daddy's finger, then you'll just see that SOS kind of melt away.
Jan and Caleb's dad notice these SOSs. Speaking quietly, glancing to the side, holding his hands against his chest, swaying, and swaddling are good ways to respond to Caleb's SOS.